Hello, our dear viewers, and welcome to a new edition of Africa Today. In today's edition, we are going to talk about the cooperation between the different African nations concerning the repercussion of COVID-19, as well as the preparations for the vaccination process for facing the COVID-19, while Egypt is seeking to manufacture COVID-19 vaccines for Africa as well as the Middle East. We'll start with this report where Egypt affirmed readiness to provide Africa and the Middle East with coronavirus vaccines as soon as manufacturing kicks off. Egypt Minister of Health and Population, Dr. Hala Zeid, revealed that work is underway to make Egypt a hub for manufacturing vaccines for Africa and the Middle East in the coming period. Abir Mitwali reports.
Affirmed readiness to provide Africa and the Middle East with coronavirus vaccine as soon as manufacturing kicks off. Egyptian Minister of Health and Population Hala Zeid revealed that work is underway to make Egypt a hub for manufacturing vaccines for Africa and the Middle East in the coming period. This came in remarks she made on Thursday during a video conference meeting of the Bureau of the Assembly of African Union Heads of State and Government and Heads of Regional Economic Assemblies. According to Zeid, Cairo wants to join the COVID-19 African Vaccine Acquisition Task Team. The team initiative aims to accelerate African participation in the vaccine's clinical development, overcome all financing-linked challenges to provide vaccines to eligible groups, and support African countries' capacities to produce and distribute the vaccine among citizens. She highlighted the importance of cooperation among all African countries to bolster the maximum benefit from the initiative. Egypt has participated with other world countries in clinical trials as part of a research package into the clinical trial in its third phase of the emerging coronavirus vaccine in cooperation with the Chinese government and the UAE G42 healthcare company. She said partnership among countries had become a reason for creating one of the virus-effective vaccines, calling for solidarity among all countries of the African continent at this difficult time to overcome the crisis. Zeid pointed to the importance of maximizing the benefit from the African Medicine Agency Treaty, saying that it allows African countries to use emergency registration of vaccines, adopt a policy of optimal use of vaccines, move vaccine surpluses to the countries in need the most, and exchange experiences among countries in this field. The minister affirmed her country's readiness to freely share its e-system that allows recording and tracking vaccine response with countries that cannot set up similar systems. Also, Zeid noted that the rate of COVID-19 infections has decreased by 11% last week in the country.
To shed more light on the issue, we are very much delighted to have our dear guest in the studio over the phone, Ambassador Gamal Bayoumi, former Assistant Foreign Minister. Ambassador Bayoumi, good afternoon to you, sir. Ambassador Bayoumi?
Yes, hello, I hear you. Hello.
Hello, sir. Ambassador Bayoumi, Egypt affirmed its readiness to provide Africa and the Middle East with the coronavirus vaccines as soon as manufacturing kicks off. How do you view this statement, which was issued by the Minister of Health?
One more step of the Egyptian solidarity with Africa. It's not something strange because we are everywhere in Africa. Egypt is the most represented itself in Africa. If you compare our presence in Africa with other countries, we have in every African capital small or relatively medium-sized embassy. So we have Egyptian fund for development Africa. Now it is an agency for development and association with Africa. Now we are enlarging the relation with Africa. Instead of having the COMESA with 21 countries, now we are having more than 50 countries in one big free trade area. All these efforts are a sort of cornerstones of our readiness to help more and more in Africa. Also, I must here recall the decision taken in the G20 in Riyadh lately that the richest 20 economies are going to allocate a huge sum of money to help the whole world against the corona disease and against the death problem also. And Egypt is doing its best to do that. Now we are on the phase of manufacturing the remedy for the corona, and of course it's part of our thinking is to make it available to our brothers in the Arab world and in Africa also, whenever they need and they cannot cover the cost of such a remedy. This is very good. This is one more step in strengthening the relation between Egypt and its partners in Africa.
Yes, Ambassador Bayoumi, how do you see Egypt's leading role in Africa recently?
We started by our president chairing the African Union in 2019, and it was a very active presidency, as a matter of fact. For that, he went to Tokyo one day. After a few days, he went to Paris, then back again to Tokyo for several reasons, for the G20, for the G7, for the Japanese-African relations, for the Chinese-African relations. We are calling all the main partners to come and invest in Africa with the Egyptian experience. This is very important. So Egypt is trying to help our dear friends in Africa, and at the same time Egypt is benefiting from that by enlarging our trade, enlarging our exports. We have our experts everywhere in Africa in the field of industry, agriculture, fishery, name it. We teachers in French language, and I witnessed this myself when I served in Africa, that we are helping Africa, and we are the most experienced country concerning this, and our experts are not that expensive. It is within the possibility of any country who wants to make use of them.
Ambassador Bayoumi, Minister of Health, Dr. Hala Zayed, said that CARO wants to join the COVID-19 African Vaccine Acquisition Task Team, the AVATT. How actually could this be fulfilled from your point of view?
I think everybody expects Egypt to do that. And we have a very advanced pharmaceutical industry in Egypt. We are well known by exporting pharmaceuticals to all the countries around us. And I enjoyed doing that when I was in the service of our diplomacy. It's well accepted everywhere, and also it is much more efficient and much more cheaper. So I hope that Dr. Hala Zayed will continue in this dimension. It's one dimension which can come with very good results and very good stories of success in our relation with the Arab world, with Africa, with Latin America even.
Yes. Sir, how do you view the importance of the cooperation between the different African nations to bolster the maximum benefit from this initiative for the vaccine issue?
It is very important because here, of course, we are helping others. But why in this specific problem, while you are helping your neighbors, you are helping yourself, because all of us are trying to cooperate on the international level, on the regional level, to combat this disease. Otherwise, it will come to us in a worse way. So, although which comes to your mind at the beginning that we are helping others, but as a matter of fact, as a human being, I say that we are helping ourselves when we help our neighbors in order to stop this disease. So it is normal, it is expected from a country in the size of Egypt.
Yes. Ambassador Gamal Bayoumi, former Assistant Foreign Minister, always a pleasure to listen to your precious input.
Thank
and
you.
Moving on with our program, where the Secretary General of the African Continental Free Trade Area, the AfCFTA, Wamkel Mene, came to Egypt to discuss his role in this initiative. During the visit to Egypt, the AfCFTA Secretary General held a series of key meetings pursuant to the African Free Trade Agreement, which is brought into effect as of the beginning of 2021.
Egypt's ambassador in Accra, Ahmed Hanna, held an expanded coordination meeting with Secretary General of the African Continental Free Trade Area, Wamkele Mene, to discuss preparations for Mene's anticipated visit to Cairo, started on Saturday. During his visit to Egypt, the Secretary General held a series of key meetings to the African Free Trade Agreement, which is brought into effect as of the beginning of 2021. During the meeting, Mene said he is pleased that Cairo would be the first African capital to visit in conjunction with efforts to bring into effect such an ambitious agreement, which Egypt has played a major role to activate during its chairmanship of the African Union. He expressed his keenness to cooperate with the Egyptian side and benefit from its great experiences to create a unified African market, having an effective role in the global trade arena. He also expressed his gratitude for Egypt's significant support to the agreement and its affiliate newly formed Secretariat, hailing Cairo's leading role in the regional and international arenas, as well as its wise management of the continent's issues during President Abdel Fattah el-Sisi's presidency of the AU. Meanwhile, the Egyptian ambassador welcomed Mene's upcoming visit to Cairo, which he said will help serve the sustainable development goals in Africa. In this regard, Hanna asserted the Egyptian political leadership's keenness on achieving the aspired African integration.
South African President Cyril Ramaphosa said millions of coronavirus vaccine doses secured by the African Union will be allocated according to the country's population. More details in the following story by Marwa Fahim.
South African President Cyril Ramaphosa said millions of coronavirus vaccine doses secured by the African Union will be allocated according to country's population size. Ramaphosa, who is the current AU chairman, said on Wednesday that vaccines from Pfizer, Johnson & Johnson and AstraZeneca would be available this year, but he did not specify how much each African country would get. No African countries have begun large-scale coronavirus vaccination campaigns, and the AU's 270 million shots, if administered per person, would still only cover around 10% of the continent's 1.3 billion people. The CDC did not respond to a request for further detail. Its director cautioned that vaccines would not be a magic bullet for Africa, as it would take time for them to be rolled out and a second wave of infections had not yet peaked. The continent's confirmed cases have passed 3.1 million, with more than 76,000 deaths, according to Italy. Speaking to South African news website, Ramaphosa also suggested that the AU would access vaccines from China. He said that China will also be part of that, although they will join later. South Africa itself plans to access doses via three sources: the EU arrangement, the COVAX facility, co-led by the World Health Organization, and direct deals with manufacturers.
Well, with that, our dear viewers, we come to the end of this edition of Africa Today. Hope you have enjoyed it. Until tomorrow with another crew, it's goodbye.